Good morning to all of you out there. Welcome to the program agenda. It's June 16, 2021. It's a Thursday. I'm your host, Cito Beltran, and you are watching us via Cignal TV channels 8 and 250 for high definition, and on facebook.com/onenewsph. You can also watch us by YouTube, One News PH. And if you download the Signal Play app, you will be able to watch us on the go. And thank you very much to PLDT, Mr. Marco Borlongan, for sustaining our broadcast out here in Lipa City through PLDT home fiber optic internet. Yan po, no? And if you notice that I'm kind of doing stop and go in my introduction, bear with me. Siguro naman, pareho ko na rin kayo na parang hindi natutunawan, suffering the indigestion of all the news, all the recycled, recirculating good news, bad news in the country. There are days when you just want to learn more about what is John Lloyd doing, or when will the Fast and Furious episode 9 show, kasi parang talaga pong nakakasawa na, parang walang katapusan itong bad news, good news na ito. And right now, I'm actually working on an article for the Philippine Star, which I will probably entitle Dr. No or Confucian Says. Kasi if you grew up in my generation or you are older, chances are you are familiar with the sayings of Confucius. Okay? Kanya lang ngayon po dito sa Pilipinas, it seems it is the sayings of Confucian, where you have one cabinet secretary saying, you have to do this, and you have a governor or a undersecretary or a political appointee saying otherwise. And ayan na po, Confucian says, you better lead what you say before you speak, okay? Kasi ang nangyayari, sila hindi magkaintindihan. But before I ruin your day, and you might be wondering, sino si Dr. No? Isipin nyo, sino ang Dr. No na lagi na lang no? No to senior citizens going out. No to senior citizens vaccinated going out. No to not wearing face shield. No. Si Dr. No. Isipin nyo na lang. Anyway, let's go to the front page of the Philippine Star. And here we go. OCTA Research Group, Metro local government units now at moderate risk. Okay. The IMF, or International Monetary Fund, cuts GDP growth forecast to 5.4%. Duterte in 2022 will never happen, according to Mayor Sara Duterte. And the subtitle to that headline is Rodi endorses Martin Romualdez for VP. And Malacanang says ICC report based on hearsay. That's the upper part. Let's go to the lower part. Supreme Court junks Napoles plea for release. ICC can pursue Philippine probe even without government cooperation. No sticky fingers in vaccine purchase, according to senators. And DOH eases up on face shields outdoors. Pero warning po yan, kasi sabi ni Undersecretary and healing SAR ba raw? Treatment SAR. Si treatment SAR, munti ka na sabi healing miracle maker. No? Pero according to Yusek Leopoldo Vega, which I support, no? We've always said that it is no longer necessary to wear the face mask outdoors. Only in transportation, in congested areas, and enclosed spaces. Mag-face shield, hindi po face mask. Ako, nahihilo na ako. Mag-face shield, hindi na kailangan daw yung face shield. Pero may doctor sabi, no, 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 no. That's not correct. You should still wear the face shield. So, baka po kayo matikitan dahil sa confusion says. Okay, let's go to the stories behind those headlines. OCTA research says all areas in National Capital Region or NCR are now considered moderate risk as the number of new infections continue to decline. But what is the situation in cities and provinces outside Metro Manila? We will discuss that later on the program with Father Nick Austriaco of OCTA Research Group. And next, the International Monetary Fund, or IMF, has slashed its gross domestic product, or GDP, growth forecast for the Philippines to 5.4%. IMF says this is mostly due to the second wave of pandemic, which peaked in April. And in politics, Davao City Mayor and presidential daughter Sara Duterte doused the speculations on the Duterte tandem between her and her father, President Rodrigo Duterte, for the 2022 elections. This, as President himself, also endorsed House Majority Floor Leader Martin Romualdez for Vice President. Ayan po, no? And our quote for the day comes from the book of Psalms in the Bible, chapter 77, verse 11. I will remember the deeds of the Lord. Yes, I will remember your miracles of long ago. In case you're wondering, what's the relevance of that Bible verse to what's happening in the country? Given my state of mind, my physical condition, I'm tired, and most of you are, you kind of feel you're in a slump, you're in the dump. And if you're faltering, if you're, feeling you're about to lose it, just remember the works, the promises, the promises made and kept by God in the past. Kumbaga, balikan mo yung mga true story, success story, fulfilled promises, wishes come true from God, and it will revive you, refresh you. Okay? And yun lang po, no? Just a word of reminder to our local government officials, our police, etc. Recently, there was a bus driver, a unemployed bus driver who essentially lost it, decided to kill his children and his wife, and then hung himself because he didn't know what to do anymore. And a barangay captain summarized all of that grim event as naburyong. And the word naburyong basically is someone who is who loses it, is mad, is gone insane or crazy, etc. But that's depression. I just want to put that word there, depression. Yung buryong po kasi parang nawawala sa konteksto, nawawala sa totoong kalalagyan yung pangyayari. The man apparently went into extreme depression. He didn't go crazy. He didn't go nuts, as we all would like to dismiss. And the reason I'm mentioning this is because a lot of us do not recognize depression in the Philippines. Parang, nagluluksa lang yan. Ay, broken-hearted lang yan. Ay, naburyong. Be sensitive to people around us. Okay, sandali. Wait a minute, may sinasabi itong aking executive producer. Senate President Tito posted this on Twitter an hour ago. Last night, the president agreed that face shields should only be used in hospitals, allowed us to remove ours. Attention DOH. Yan po yung post ni Senate President Tito Soto. Yan po ang problema kasi honestly, with all due respect to Tito Soto, who I really respect, dito po sa Pilipinas, hindi mo na alam kung kanino ka makikinig. Kasi kung minsan magmi-meeting ang presidente at cabinet secretary, sasabihin ni presidente, version 1, sasabihin ng cabinet secretary, version 2, tapos sa labas, version 3. Yun na nga lang sa Cebu. Sige, stay muna. No, or go. Stay. No. You follow the DOH, blah, blah, blah. Ngayon, ganun na naman. So, confusion says, welcome to the Philippines. Now, let's go to our program kasi baka masira araw ninyo. I don't want to ruin your day, but let's go to our first interview. The number of COVID cases in Metro Manila is on a downward trend. Daw, okay, not according to the Philippine College of Physicians. However, several doctors expressed alarm on the increasing rate of hospital utilization in NCR. Are our hospitals getting overwhelmed again? Tanungin po natin from the Private Hospitals Association of the Philippines, the President, Dr. Jose De Grano. Dr. De Grano, welcome to the program, sir.
Yes, good morning, Cito, and thank you for having me here.
Nakainom ka na ba ng antidepressant, Dr. De Grano? Kasi baka ma-depress kang kausap ako today.
No, hindi, Cito.
Ako'y masisira na ulo ko din kasi hindi ko na alam kung sino papaniwala ako. Dr. De Grano, what is our situation? Kasi according to IATF, good na. According to Malacanang, good na. According to Philippine College of Physicians, it's bad. Now, you're on the ground. You work in different hospitals. I think you work with San Juan de Dios Hospital. And balita ko, meron ka raw pinagtatrabaho ang hospital din sa Batangas.
Dito sa Lipomedics, siguro we are 5 minutes away lang from each other.
Yun, maigi. So, can we please find out from you, objectively, independently, as far as the Hospital Association members are concerned, what's the situation?
Well, sa NCR po, as far as the statistics show, talagang bumaba. Bumaba yung mga number of cases ng COVID sa private hospitals. And then, ang sinasabi natin is because majority of the cases naman, ng active cases, around 95%, do not require really hospital beds. They are both sa mga isolation facilities. Now, the hospital beds are reserved mainly for the moderate and the severe cases. Now, some are saying that the ICU beds are full. We tried to contact some hospitals here in NCR, and we found out that really some ICU beds allotted or allocated for COVID cases are full. But if you will note, hindi naman po hindi naman lahat ng ICU beds in a private hospitals are allocated for COVID cases. Only a very small percentage, let's say 20% of the beds are allocated for COVID cases. Maybe 1 or 2% lang ng mga beds na yon are ICU beds. Because, let's say, katulad ng ibang hospital, sabi nila, full sila. One hospital in Quezon City is full. Pero ilan yung beds na? 3 beds lang ang allocated for COVID.
Yan na nga ba sinasabi ko
Hindi, it doesn't, nasasabihin mo na, well, punuan. But then, if you will note, tumawag kami sa isang hospital, sabi, yes, we are full, but we are full of non-COVID cases. Dadalawa lang ang
Mm.
aming COVID na
Mm.
ICU. So,
No,
yun. Oo.
Dr. De Grano, I'm sorry, no, I have to ask
Mm.
questions as they come to mind.
Yes.
And wala naman akong politika din no. Pero
Mm.
does it matter in a pandemic or in a health crisis as we have? Does it matter as to percentages of illness in regards to ICU beds available? Kasi tama, accurate yung sinabi mo. Kung tatatlo
Mm.
ang kama para sa
Yes.
ICU at
Full lang.
isa o dalawa, talagang magiging full. Pero ang tanong, does it matter? Kasi parang kung puno, puno.
Mm.
Kay cancer yan, kay heart attack yan,
Mm.
puno. I guess the bottom line is, puno ba talaga, nagkakaubusan ba ng ICU beds? Kasi whether I have COVID or I have a heart attack, I still need to be in the ICU.
Yes. But only in a few hospitals po. If you will call or check on these big hospitals, private hospitals in NCR, hindi po talaga sila full talaga. May open pa
Okay.
sila, especially for non-COVID cases.
Okay. So that's good, no? So kumbaga, nag-i-improve talaga yung sitwasyon.
Yes.
Okay, paano naman outside of NCR? Kasi alam mo, 1 month ago or a month and a half ago, din sa Lipa, where you and I are, people were saying, Kuyang, kaming tiga Lipa, hindi na makapasok ng hospital because many patients are from Metro Manila or NCR Plus. Kamusta ba sa Region 4?
Ang Region 4 pa mataas din ngayon, ano? Actually dito sa Lipa, if you will know, pag nagtatuwag kayo sa ating mga hospitals, mga 4 or 5 big hospitals here, halos puno din talaga ang and then may waiting list din sila na tinatawag, ano? And even Region 3, Region 2, Cagayan and Isabela, punuan din po 'yan. Then we called up our Visayas officers. Puno sila. And then they were asking help from DOH regarding augmentation of their staff. And even naman sa Bicol right now, mataas din po ang kanilang nagkakaroon din sila ng surge. Sa Mindanao, Northern Mindanao, which is Cagayan de Oro, then Davao, and then some areas in Cotabato, talagang punuan din po. Yun ang problem nila. Yes.
Okay, Dr. De Grano, in your estimation or in your analysis, ano ba sitwasyon natin? Forgive my French, are we in deep shit?
Medyo, kasi alam niyo po, the problem I think is yung full implementation din ng minimum health protocols. Our people are too complacent. Ibig sabihin, relax agad sila kasi MGCQ na tayo. So okay na. I don't have to wear mask. I don't have to do social distancing. Pwede na akong mag-gathering, social gathering, birthday dito, birthday doon, inuman dito, inuman doon. And then now, biglang tumaas na naman ang kaso because the variants are here na talagang very high ang transmissibility. Ang bilis makahawa ng mga yan. And then sasabihin nila, ang nahahawa po dyan right now are the elderly at saka yung with comorbidities. Then nagtataka sila, hindi naman lumalabas ng bahay yung nanay ko bakit may infection? Sino may dala? Siyempre kayo. Yung
mga pinalabas para maghanap buhay daw, yung mga A4.
Yes. Kasi sasabihin nila, negative naman ako. But it doesn't mean na you are not a carrier. Di ba? If negative ka nga, pero pag uwi mo sa bahay, carrier ka, yung nanay or siyempre, hindi protected yan sa bahay. Wala naman kayong mask sa bahay So yun, nahahawa siya. Siya very vulnerable, Mababa ang immunity nila. So yun ang problema natin. Kaya ang kumalat.
Yeah, no, Dr. De Grano, kanina nabanggit mo, we were talking about ICU beds for non-COVID cases. Now, I don't know if I'm just imagining this or it's just coincidental within my world, okay, na yung kapatid ko may cancer, yung isang pamangkin ko sa Netherlands may cancer, etc. And parang sabi ko, Ano ba nangyayari? Nakakalimutan na ba tayo na may mga ibang sakit pa? Are we, do we have a blind spot regarding other life-threatening diseases that may eventually or may in the coming months come back to bite all of us?
Well, ang tingin ko po dyan is, the people are, complacent sila, and then they are afraid. They are afraid to go to the hospitals to consult again. Sasabihin nila, ako baka huwag na tayong pumunta, okay pa naman ang pakilasa ko. I don't need to go and to have a check-up with my attending physician because I'm feeling well. The problem is yung kanyang mga, let's say, nalilimutan na meron siyang maintenance medications na he has to take diligently, and also he has to get some examinations like blood examinations just to see if okay talaga ang situation niya. But then papasok siya sa hospital, medyo grabe na. Ibig sabihin, hindi siya nakapag-follow up, ganyan. Yung iba nga, supposedly, merong yung mga treatment for comorbidities like cancer, etc. Nalilimutan nila. And then pagpunta nila ngayon sa kanilang mga doctors, medyo grabe na ang situation. Dumarating sa, let's say, nasa stage 2, biglang stage 4 na pala. Biglang gano'n. So, yun po ang usual na nangyayari right now.
But Dr. De Grano, right now, meron ka na bang na, kumbaga, di ba, pinapalpate mo ba yun? Tama ba yung pinapalpate? Yes. Pinupulsuhan mo. Pinapupulsuhan na ba kayong mga disaster in the making na, kumbaga, nako, eto na yung dengue, nako, eto na yung meron bang lumalabas sa radar natin na dapat mabantayan na?
Yes, right now. If you will note sa mga hospitals, wala po halos ngayong mga pediatric patients, Walang well, they are saying na wala namang kasi mga bata hindi lumalabas. So they do not get infected, So yun, kokonti halos ang pasyente natin na pediatrics, But then they are expecting, our pediatricians expecting an upsurge of dengue cases in the next coming months. Because of yung weather natin, etc. And I think the pediatricians are preparing for that.
Okay, so dengue is something you guys are watching out for. Ngayon, mabalikan ko lang yung COVID, Doc. Kasi sabi mo nga, maraming pasaway, they're not observing the health protocols. Do you have a number of repeat COVID customers dyan? Kasi may alam ako, isa, tinamaan na ng dengue, wala pa rin tigil yung karaoke. Tsaka yung party. Sabi ko, mag-ingat ka kasi na 1-0 ka na, baka yung second round mo, hindi ka makalusot dyan.
Yes, meron mga ganon. Actually, after the first dose, sabi nila, okay na ako. I mean, they are too complacent. Sabi nila, na-injection na ako, so okay na. Hindi na nila fina-follow yung minimum health protocols. And then, wala pa silang second dose, And then, let's just say na nakapag second dose na, they have to be, it will have to be explained na they have to wait na for at least 2 weeks, for the full, yung, nung effect nung vaccine na yan. And then, of course, hindi naman, it will not protect you fully from the virus, Alam naman natin na gano'n. Will only usually prevent the severity of the disease. Pero yung then you still have to follow yung ating minimum health protocols. Kahit po mayroon tayong bakuna. Yun po dapat nating malaman.
Do you have members outside of the Luzon, island of Luzon, lalo na sa Bicol, sa Visayas and Mindanao? Because mukhang sila naman ngayon ang the new battleground.
Yes, we have. I have just contacted our officers in Visayas and Mindanao. Talaga po, ang problem kasi doon, konti lang ang government facilities, Yeah. There are small private hospitals and overwhelmed din sila. Kasi kukunti lang naman ang bed capacity ng mga private hospitals. And yun ang nagiging problem nila ngayon. Punuan talaga sila. And then siguro they do not have the number of isolation facilities na katulad ng NCR.
Yeah.
So,
Now, given the situation where ako po, nagtatanong lang ako ng mga tanong, mga kaibigan, wag niyo akong kulamin, parang awa niyo na, hindi pa ako natutunawan. Given the situation where things are improving in the National Capital Region, some people are suggesting, nagkakagulo-gulo na sa Visayas at Mindanao, Bicol, a doctor in Bicol, president of the Philippine College of Physicians chapter in
yes.
Bicol, even said that we are at risk of becoming the Philippine version of India.
Yeah.
Dahil kokonti ang facilities, hirap na hirap,
Yes.
ang daming kaso. Would you support a shift of vaccination priority to Bicol, to Davao, to Cagayan de Oro, etc.?
Well, palagay ko gano'n, ano? That should have been done earlier. Dapat yung mga lahat namang actually dapat of course nag-concentrate sila sa NCR plus bubble, ano. But then right now makita natin na the areas na nag-MGCQ or very relaxed areas ngayon ang biglang tumataas, ano. Then I think we should really send them if we have the supply, ano. We should send them enough vaccines to these areas, you know.
Okay, now, Dr. De Grano, shift gears tayo kasi
No?
meron ako nabalitaan kagabi na yung ombudsman yata yun, binasura. They junked the charges against the PhilHealth officials, those who were charged with corruption, blah, 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 which I have said, at least for the last two administration. Sabi ko, you guys are barking up the wrong tree. You are chasing the wrong people. And the ombudsman basically proved that. Now, how does that affect the private hospital association's relationship with the PhilHealth? Kayo ba naniniwalang, you don't have to agree with me, but do you agree with the decision of the ombudsman na tama lang na binasura yung mga kaso na yon, and do you feel that that will change, improve yung mga bayaran, etc.?
Yeah, I have not read the decision, but then right now the Private Hospitals Association and even the Philippine Hospitals Association are meeting with President Dante Giran, and we are trying to stress out yung problems ng payment nitong mga aming receivables or reimbursements, and actually they are trying to resolve it, but then medyo delayed pa rin yung mga payments, especially in other areas. But here in our region 4B, I can say na medyo okay kasi we have a good relationship with our RVP, yung regional vice president namin. So most of the hospitals, especially here in Batangas, are being paid, so they are not really complaining that much, but still meron pa rin, of course, na some reimbursements in 2020 that they are trying to follow up, and but then the RVP, as I said, is open naman for negotiation or for cooperating with us regarding this payment. So right now I think there has to be just good communication between PhilHealth and the hospitals, kasi talagang hirap na hirap po talaga ang mga hospitals right now.
Dr. De Grano, Governor Gwen Garcia in a press conference about 2 weeks ago mentioned something that has been going, been surfacing now and then, parang palitaw. Yung mga claims or death of alleged COVID-19 deaths. Kasi may mga nagsasabi, wala namang COVID, sinabi namatay ng COVID. In fact, I know one personally na as far as the family is concerned, this is in Metro Manila, no? The father of the family died of a heart attack. And pinalabas doon sa death certificate or lumabas sa death certificate COVID-19. And sabi ng pamilya, hindi ko na yung maintindihan. And another one said na they were advised to agree that it is COVID-19 because that way the hospital bills would be greatly reduced.
Mhm.
Does that make sense? And what really happens? What's the difference between a patient who dies from COVID-19 and a
Mhm.
patient who dies of natural causes in the pandemic relative to compensation, reimbursements, etc.?
Yeah, medyo malaking difference nga doon, no? But first, bago ka maging COVID positive, kailangan meron kang certification from an accredited RT-PCR laboratory, no? So
Mm.
attach 'yon, and that is a certified certificate ng ng positivity mo sa COVID. Now,
Mm.
regarding doon sa mga charges, and let's say nagstay for 2 days in a hospital, nag-heart attack, but then it just so happened na nag-positive in COVID. Siyempre, ang diagnosis niya usually is yung problem niya sa heart, no?
Mm.
Just so happened na nag-positive. I'm not sure kung talagang totoo yan sinasabi ng pasyente na the hospitals will just say it's a COVID case because they want to have more reimbursement from PhilHealth. But the problem here is, ang problem ng private hospitals, we do not get reimbursed. So why will we get a
Mm.
higher benefit for a patient? Di ba?
What about kung public hospital? Kasi yung isa, alam ko, government hospital, kaya hindi ko maintindihan eh.
Actually, pareho lang ang private and government are not being paid also. Government
Mhm.
hospitals, it does not give them an advantage, I
Mhm.
don't know, because ang government hospitals, they do not complain. Of course,
Mhm.
because they have subsidies from the government, di ba?
Yeah.
So, yes, but for us, private hospitals, yung upcasing na katulad noon, I
Yeah.
don't think the hospitals will do that because, matatie up sa iyo yung ganong kalaki na benefits versus a lower benefit, di ba? Let's say, moderate case ka. Ang moderate
Yeah.
case, 143,000.
Mm.
Pag severe case ka, 333,000 ang
Mm.
benefit mo. But then, sasabihin mo, sige, gawin na lang natin itong severe kasi 333 ay sa private hospitals, we have already spent a lot for the patient. Let's say, for
Mhm.
a severe case, 500,000 na. And then,
Oo.
ibabawas mo 333,000 para yung excess ay mas supposedly lower at may makuha ka. No, it's not that case, Pero of course, sinasabi lagi ng PhilHealth, you're not supposed to charge, these patients. Who will pay for the excess? Naman.
Ayun. Okay.
So,
Doc,
mabigat na yun.
let's go for a quick break and then balikan natin yung mga sakit ng ulo ng pagpapalakad ng hospital at
Yes.
malaman ko, meron ba pinagbibiling hospital dyan? Okay. We'll be right back here
Yeah.
on Agenda.
Thank you.
Okay, let's bring back Dr. De Grano of the Private Hospitals Association. Doc, yung mga sabi-sabi na nahihirapan na raw mga private hospitals, yung mga maliliit. Kasi alam ko, dito sa Lipa, marami-rami tayong mga maliliit na hospital.
Yes.
And I mean, I'm speaking nationwide, that there are some private hospitals, small ones, that are opting to close down.
Mhm. Yes, actually, dun sa aming record, recently may dalawang small hospitals, one in Mindanao and the other one is in Samar. No? Ang reason nila is they can no longer continue with the operations kasi nga wala silang na-delay yung payments ng PhilHealth, and they are very small na talagang they are relying only on the reimbursements from PhilHealth. But these are only two. The other hospitals here are doing its best just to continue with the operations,
Mhm.
like downsizing. Let's say from 150 beds, nag-downsize sila sa let's say 50 beds na lang. Para
Bakit?
uh, at least the number of nurses, kasi kukunti na actually ang number of nurses natin, If
Aha.
you have let's say 150 beds, you need at least let's say 100 nurses. Pero kung 50 beds ka lang, baka kaya mo at least 30 nurses lang, pwede na eh. And then
Mhm.
downsize, the other thing that they are doing is yung nagre-reduce working hours sila. Yung mga employees, instead of working daily for let's say for a week na 5 days, ginagawa
But
nila MWF,
yeah.
TTHS lang.
But
Ganon.
Dr. De Grano, isn't this, I won't call it a disservice, but isn't this taking away much needed service to the public or to the customers, whether it's, I mean, primarily private hospitals.
Yes.
Kumbaga, nagbawas ka, hindi ka na nakakatulong.
Hindi naman po kasi right now talagang bumagsak yung admissions ng private hospitals. Yeah, from
Okay.
100 before dito sa Lipa Medics we were let's say averaging 250 admissions, di ba?
Ang hirap nga pumarada diyan sa Lipa Medics, eh, kanya
Hindi
nagpupunta
naman
kami sa albularyo, eh.
Ay, hindi. Maraming bakante doon sa likod. May mga parking
Okay.
space po sa likod. But then
Okay.
yun na nga, kung we continue the operations based on the previous census of
Mhm.
admissions, medyo very costly. So right now bumagsak talaga ang census ng mga private hospitals to 50% or less, nung dati nila. So let's say before we are admitting 100 cases.
Yeah.
Ngayon, less than 50 lang or even less. Kaya nga medyo talagang the hospitals have to downsize, decrease their or minimize their expenses just
Mhm.
so they will be able to survive. And some have taken bank loans just
Okay,
to continue. Oh,
quick last question, Dr. De Grano. Nabanggit mo yung shortages of nurses.
yes.
What's the problem? Is it because according to some people, kasi pinasara yung maraming mga below par diploma mills ng nursing, or is it because people have simply gone to another course? What's the primary reason?
Well, yun po yung planning siguro na tinatawag natin ng CHED, Previously, sobrang daming nurses. Biglang sinabi nila, oh, you're going, parang diploma mill yan, So, we
Hmm.
have to control it. So, yun, biglang bumagsak naman yung schools. Biglang pinasara nila yung mga schools. And then, pumasok pa po yung K-12 thing. Biglang nagkaroon ng gap na 2 years. So, right now, actually, we are not producing enough nurses. Ang next ating production ng nurses siguro in 2022 pa after they have passed their board exams. So,
Kaya nga, nung
years.
natanong ko yung aking tiyuhin, si Prince Charles, lungkot na lungkot siya dahil kulang na kulang daw yung mga nag-aalaga sa kanila. Anyway, Dr. De
Yes.
Grano, thank you very much. And ladies and gentlemen, liliwanagin ko lang po, yung sinasabi ko kaninang mahirap pumarada, biro lang po yun. I was actually, it was a compliment in the sense na there are so many people who go to that hospital. Anyway, Dr. De Grano, maraming salamat for your time, and I do hope you will stay in touch with us. Let
Yes.
us know if certain things develop, and we would be happy to discuss it here.
Thank you, Cito, and all the televiewers. Thank you.
Okay, yan po si Dr. Jose de Grano, President, Private Hospitals Association of the Philippines. Let's go for a quick break. When we return, puntahan naman natin si Father Nick Austriaco of the UST OCTA Research Group. We'll be right back here on Agenda. Welcome back to the program Agenda. I'm your host, Cito Beltran, and you are watching us via Cignal TV channels 8 and 250, as well as on facebook.com/OneNewsPH. And now let's bring in a regular on Agenda, someone who has always been a very good and credible source for data and analysis. We have with us Father Nick Austriaco, OCTA Research Group. Father Nick, welcome back.
Good morning, Cito. Thank you for having me back.
May I know if you are here or in the United States?
I'm here in Las Piñas, actually. I'm visiting my mother.
Okay, well, is she all right? I hope
she's fine. Yeah. Thank you for asking.
Well, it's something that is constantly on my radar, Father Nick, because I have
Waiting
a lot
for
of
the vaccine. So she's supposed to be vaccinated this week or next week. We are waiting. So
Okay. Word of caution, Father Nick, paghandaan mo na. Kasi pag nabakunahan na yan, ubos na ang oras mo. Dakilang driver ka na naman.
I told her 2 doses, so we have to wait for the second dose. So
Yeah, because I know of so many friends like you whose parents have been vaccinated and now they're saying, Kuya, when bago bakuna, pinoproblema ko depression. Ngayon, ang pinoproblema ko, oppression. Makulit na naman ang nanay ko. Well, enjoy the parents that you have because
Thank
mine,
you.
both mine are have passed away. So enjoy the company that you have. Now, Father Nick, I'm happy we're off on a good start. But when we look at the data, I just feel like we are on a not very merry-go-round. You know, cases go up here, go down here, go up here, etc. What's your reading in all of this?
So this is actually what you are seeing now has been and has always been a predictable behavior of the virus. So, when I explain to my students, the best way to understand how viruses spread is you imagine taking a drop of black ink and putting it into a glass of water, and the drop will fall in, and then slowly it will spread out. And the drops always begin in the NCR. So the NCR is driving this pandemic in the Philippines, and the drops are variants. So you drop the variant. The variant arrived in the Philippines in January and February. It landed in the NCR. So we had our surge and March and April. And remember, we locked down. So we prevented that virus from spreading. Well, what happens is that once we release the lockdown and once we open the NCR bubble, the ink begins to spread again. And so that's what you're seeing. You're seeing the ink spread everywhere except Cebu. And the reason why Cebu has not been, so people go, why has Cebu, the Visayas, Mindanao, especially Bicol, but why not Cebu? Because Cebu had variants before. So what you're seeing is variants spread. And so the variants are spreading all over the Philippines, and they will spread until, just like here in the NCR, they are shut down. And so I was listening to your previous guest. It's really important right now that we emphasize that what we learned from Manila, from the experience of the NCR Plus bubble, is that we have to lock down. You have to lock down, especially since, as your guest pointed out, the healthcare utilization infrastructure in the rest of the country is much thinner than in Metro Manila. So you cannot let the numbers rise as we allow them to rise because they were overwhelmed. And I've heard, tragic case scenario like in Cotabato, I heard they're talking about oxygen already. That type of concern suggests that we are approaching dangerous levels. And what has to happen is MECQ or even ECQ, just like here, we just have to shut everything down. And because the caseloads are lower, the lockdown will be shorter, right? We waited a long time until we were getting something like 6,000 or 8,000 cases in the NCR, and then we locked down, and it took weeks to relieve that. Hopefully, we learned from that lesson, and the provinces will lock down sooner. And if they lock down sooner, the lockdown will be shorter.
Father Nick, please bear with me. I don't want to be a negatron, so to speak, but when I read up on vaccines, vaccination, we have been told by numerous personalities and authorities that when you get the vaccine, you will have protection, but it does not make you bulletproof. You will still get COVID-19 under the most unfavorable circumstance. You will likely manifest some signs. It just won't kill you, and hopefully it won't land you in the ICU. That tells me that even with the vaccine, the virus still has a chance of jumping from one person to another, living with us. And so all of this notion of vaccine is the solution, vaccine will stop the spread from the NCR, Are we just kidding ourselves?
Yesterday or 2 days ago, New York and California reopened. You can go visit Disneyland now with no mask. There are no masks. There's no more social distancing, and there's only one reason why that happened, because of vaccines. So Israel opened up, and there's only one reason: vaccines. So the vaccines are working. The vaccines will end this pandemic. It will just take time. So a lot of people, you ask your guests, given the surges in the provinces, should we redistribute vaccines to prevent the surge? Now, to end the surge, one of the things you have to realize is vaccines are not deployed to end a surge. Vaccines are used to prevent a future surge. Now, why is this? Because as you probably have heard, it takes weeks, if not months, to develop immunity. You are only fully immune 2 weeks after your second dose. So if you are an AstraZeneca is 3 months. You have to wait 3 months for your second dose. So if we vaccinate people in Bicol today, there will be no effect on the pandemic, the surge, for at least 6 to 8 weeks. By then, either you are completely overwhelmed, which we will not allow to happen, or the surge is over. So the vaccines are not a solution to a current surge. They are solutions to prevent a future surge. What we know now, based on our experience with the NCR Plus, is that lockdowns are really the only way that we are able to control these variant-driven surges.
Okay, now you've talked about this is not for the problem now. This is to prevent future problems. So how do we deal with the surges? I mean, like Bicol. I think that was the most shocking, alarming statement I heard this morning when a physician in Bicol said, we could end up becoming the little India of the Philippines with COVID. And I got scared. I was shocked. I was really shocked. I said, is she being an alarmist, or is this for real?
If the surge is allowed to continue in our provinces, because of the thin infrastructure, it will not surprise me if they will be overwhelmed in a way we were not here in Manila. So in Manila, we have significant numbers of doctors and nurses and hospital beds. Bicol, many other regions, Cagayan de Oro, not so much. And so the concern here is that they will run out of the necessary the beds that they need to care for our kababayans, which is why, again, I cannot help but emphasize that one of the things we must do, which we learned from the NCR Plus experience, is that we cannot do this in little bits. We cannot do it in short piecemeal. We have to do dramatic lockdowns in order to contain that spread before it overwhelms the health infrastructure. And the national government has already imposed MECQ for, I believe, in Naga. And I completely support that. If that's not enough, they may have to go to ECQ. Now, hopefully the MECQs in the provinces will be more effective, only because population density is less there. So one of the reasons why you have to have a stricter lockdown in, say, the capital region is that there are so many people living in such a crowded area that an MECQ simply does not limit mobility in the way it could in the provinces. But I think the provinces have to be ready, if necessary, to move to an ECQ efficiently and quickly, and hopefully briefly, in order to shut down this pandemic spread.
Okay, what about this discussion, arguments about senior citizens who are fully vaccinated being allowed to go out? Apparently, there's an argument there. What Dr. No, and I think you know who I'm referring to. Dr. No says no, and some other physicians are saying they're fully vaccinated people should be allowed to go out as a incentive for other senior citizens. And then there's the argument regarding face shields. And even the World Health Organization doesn't have it on its list of protocols. So, what's your assessment on that, Father Nick?
Okay, so I will answer your first question first. I believe that it is important to incentivize vaccinations by showing people in very concrete, real ways that vaccines will change their lives for the better. And therefore, I support those who would like the national government to allow senior citizens to exit their homes. Like my mother has not left our house in 14 months, 15 months. So she's totally fine with that. But I told her when she's fully vaccinated, I hope that she will have the permission to go to a mall. Now, she needs to have her mask and she has to follow minimum health standards. But uh, we have to believe that vaccines protect. And if we believe that vaccines protect, we have to behave as if vaccines protect. And so, if they do protect senior citizens, then we have to allow them to go out if they wish, right? Again, we ask them to wear their masks. We ask them to, but their risk of severe disease and ICU care has been severely diminished. Their risk is probably equal to their children's risk. So if we allow their children to go out with mask and face shield, then we should allow their parents whose risk has been diminished to go out as well. We cannot keep them basically restrained in their house until when, right? Because they're going to be vaccinated. So that's my first point. Second point, for the face shield, I understand that the government is doing a study, and I'm waiting for that study. For me, I'm always completely science driven. If the science shows that face shields add further protection to a face mask, then so be it.
I think the science says it's 9% additional protection.
Right. So again, I think this is now a matter of prudence. So whether 9% is um, is 9% enough, right? So I understand, for example, that the DOH mentioned in the last few days that they are allowing no face shields when you're outside.
Yeah,
And
outdoors.
I think that's a reasonable thing. But they're saying that, look, when you're in a mall, put the face shield on. If you're on a bike, you don't have to have a face shield, right? So now the same thing is happening in the U.S. So in the U.S., if you do not have to wear masks for the most part, 99% of the time, but the government still mandates that if you are on an airplane or if you're in a public transportation, you still have to wear a mask. And so I think that's what we are trying to deal with here. We do not necessarily have to remove the face shield completely. If there is a 9% added protection, then let's limit that to limit face shield use to those times when a Filipino is at higher risk for transmission, right?
Last,
Yep.
yeah, last question, Father Nick. Sorry. What about these testing or at least trials for children to be vaccinated? Because people in government seems to be hemming and hawing about this, and some people are saying we have to be a little more proactive and radical because the children's future is greatly at risk, not to mention their physical well-being and mental well-being.
So chil- the case with children is complicated by several factors. First of all, they are naturally more resistant to COVID-19 than adults. First one. Second, however, there are some hints that the variants, especially the Indian variant, which is why I would like to just comment. In this debate over whether or not we should shorten the quarantine, I'm absolutely opposed to that. The entry of the Indian variant to our country would be absolutely devastating. We would have to go into another ECQ in the NCR. It would be worse than what we went through. Christmas would be destroyed, right? Christmas would be destroyed if the Indian variant enters. And you said, you're worried about India in the Camarines Sur. Well, if Indian variant arrives, we will be India. So I'm like, do not go to India. Let's follow the science. And the science says that 10-day quarantines is 99.7% effective at preventing entry of variants. The argument is let's move it down to 7 days and home quarantine. That is much lower than 90%. So now we're going to allow variants to enter. And I personally had to go to a 10-day quarantine. I've been doubly vaccinated by Moderna. I arrived in the Philippines. I was put in a hotel for 10 days. It was expensive. It was inconvenient. But to protect the Filipino people, I was willing to do that. It's a huge sacrifice. And I understand the burden, the sacrifice, but we have to ask our kababayans to sacrifice for the 110 million people, right?
Okay.
So for children, it's the same thing.
Okay, well, Father Nick, unfortunately, I've run out of time again. But
Thank you, Cito.
as always, a lot of inputs from you. Thank you very much, Father Nick. God bless you.
God bless you.
Okay, that's Father Nick Austriaco of the OCTA Research Group. And that's it for Agenda today. Continue to watch us via Cignal TV channels 8 and 250. And keep it here for the latest news. I'm Cito Beltran, and we are One News.